Okay. All right. Good afternoon. Thank you for joining the second session in our longevity series, Preparing for a Long and Healthy Life. Our goal for the next 45 minutes is to explore this topic a bit more deeply than we did last time, and to really think about longevity as a three-legged stool. Excuse me. Oops. So, in terms of, living longer better, we believe there are three basic components. The first being nutrition, understanding what your body needs and when you need it, and thinking about food as medicine, not only just as a nutritional thing that we do, to keep our bodies going, but to really think of it as using it as medicine to help us with, the diseases and illnesses that we encounter, throughout our lives. The second leg would be knowledge, knowing what your options are for care, for long-term care as you age, or maybe you're thinking about those that are in your care and how you help them make the best decisions and the right choices based on their individual needs and desires. And then finally, preparedness, having that peace of mind, knowing that someone you can trust can step into your shoes immediately and carry out your wishes. And so, now that we've passed this 1 year mark of living life during a pandemic, and we're starting to see new guidance on COVID restrictions, we today would like to just take a little step back and discuss some of the lessons, that we can take from this past year, just in terms of what steps we can take to help make our bodies stronger, to have them be better prepared if we were to get sick. How can we be more resilient, both emotionally and physically? If suddenly you were to find yourself in a caregiver role, how do you figure out what resources are available to you so that you can make those decisions, either for yourself or for those in your care? And having these conversations, with either yourself or your loved ones will help serve you well in the future. And, not to, put sort of like a whole downer on this, but if, with more than 500,000 deaths due to the pandemic, many of whom who have passed suddenly, what type of preparations could have helped ease that distress, right? And so today, I'm joined again by Ursuline College longevity experts, Stacey O'Brien, Lynn Ulatowski, and Ann Murphy-Brown, and they're going to take us on a little bit of a deeper dive. So let's start with nutrition and the fuel that our bodies need to not only survive but thrive. So Lynn, personalized nutrition is a buzzy word. It's out there in the media, it's out there in the news. What are the things that we need to know to help sort of sort through the noise and all the marketing hype and the ads, and really understanding what those different dimensions are of personalized nutrition and how they can benefit us?
Yeah, hi, thanks, Sarah. Basically, there are two definitions of personalized nutrition, a contemporary definition and a traditional one. Basically, that contemporary definition uses a genetic profile to determine everything from what wine you might like to drink to whether you'll be successful on a diet. This type is also called nutrigenomics. Now, this is a new field and definitely will be the wave of the future. But for now, the over-the-counter genetic-based nutrition test should be viewed more as a novelty. As an aside, I would also caution you to read the fine print before sharing your genes with anyone. The second type is the traditional type of personalized nutrition. Basically, what your body needs based on you, based on your age, your gender, your race, and your activity level. You should focus on the traditional approach, which incorporates the dietary guidelines of Americans. In fact, for the first time, the dietary guidelines of Americans that were released in January focused on personalized nutrition based on life stage, ethnicity, and socioeconomic status. You may remember the food guide pyramid. This was an early dietary guidelines of American version that was generalized and not based on those individualized factors. So why do we need to use the DGA? Because the recommendations outlined in the DGA have been developed in order to decrease your risk for disease. Simply put, meet the DGA recommendations, decrease your risk of disease.
That's a great way to simply put it, Lynn, right? I know, just, follow some guidelines, right? Start with the guidelines. Like, let's keep it super simple for right now, right? If you're just beginning your personalized nutrition journey. Okay, so let's talk a little bit about financial and legal planning. Anne, a lot of us think, I am young. I don't need to prepare for the future as much as, I need to live in the now. I'm healthy and fit, so I don't need to really worry about a will. I'm not that old. So I know you have a personal story about a friend whose husband who passed suddenly. Can you share that experience and sort of, what lessons we can take from that?
Sure, absolutely. In January, a close friend of mine's husband passed away. He had been ill, but his final illness was very sudden. And she was grieving and in pain and overwhelmed. And she turned to me, as we were sorting through everything, and she said, almost embarrassed, I don't know what to do. He didn't have a will. And I said to her, maybe he didn't need one. And I'll explain why. They had been married. Marriage, in marriage, most of your assets become co-owned. So for example, they lived in their marital home. It was co-owned. Both of them were on the deed. So something as simple as, her filing his death certificate with the county recorder's office would then make her the sole owner of the home. Any of his investment accounts or pensions were designated her as the beneficiary. So these pass through contract law rather than probate law. And we'll talk a little bit about probate after this segment. But so she didn't necessarily need any of those to pass through a will. These, most of their assets were co-owned. So therefore, not having a will was not the end of the world for her in that situation, because most of his assets were what we would designate as non-probate assets. So it really does make a difference. Those beneficiary designations made a huge difference because they passed through contract law, not necessarily through probate law, and their assets were co-owned. Now, for someone who's not married, who doesn't have kind of an automatic beneficiary designated on these accounts, there are steps that they can take. So having those beneficiary designations.
That's great. So, I know that when I, start a new account or whatever, those are always the first questions that come up, and you have to fill those out actually, right? To proceed with opening an account, you have to have your beneficiaries named.
Yes, you do for most accounts, but you can solely own a bank account, and it might have someone that is contacted if something happens to you, but not necessarily that, that would be transferred to them or that it would be co-owned. But there are ways to do that. So bank accounts, for example, you can have something called, like a transfer on death designation for that bank account. So if something were to happen to you, that bank account transfers to somebody and it wouldn't go through the probate process. If you're married and the account is jointly owned, then that is, that would kind of revert to that one person.
Right. Okay. So good to know. So beneficiary designations can really help save the day, I think is the most important point that you've made here. Okay. So Stacey, let's talk about caregiving responsibilities and, the long-term continuum. My parents are elderly, and at some point I will be responsible for their care. I think it's really important to highlight that having these conversations, with your loved ones ahead of illness, ahead of, sudden incapacitation is really critical to fulfilling their wishes. So can you talk to us a little bit about, exploring, long-term care options? Here we have some statistics on women, right? And as we age and how we live. And I think these are really important to keep in mind because women tend to live longer than men. And in many cases, we are living alone. More than half of us are living alone as we age. So what do we need to know? Where do people start?
I think people really need to start by having a conversation like this with a trusted family member or loved one. One of the biggest barriers to these conversations is destigmatizing the actual conversation. Older adults share the same ageist ideas as the rest of us Americans. They're older and have integrated these messages that are ageist in nature across their lifespan. And as a result, they may prefer to delay or avoid these conversations, or they may say they're not old enough yet, or it's too soon to have them, when in actuality, discussions about aging, well-being, and quality of life should be a part of our family discussions and occur much more frequently than just a conversation. It may be up to you, Sarah, as the adult child, to initiate these discussions. And if you treat this conversation as just a one-time event that occurs when a parent reaches this magical milestone of 60 or 65 or 70, then you're likely to capture them when they're still really healthy and probably actively engaged in their community and perhaps even working. They could live another 45 years. You'd expect that their perspectives over those next 45 years would change. So our ideas about health and well-being and what we consider to be quality of life will be different at 60 than they are at 70 or at 80, 90, and 100. So regular discussions about well-being and health and quality of life are important to capture the older person's perspectives across those 45 years. Research supports that nearly 90% of people over age 65 want to stay in their own homes for as long as possible. And 80% believe their current residence is where they will live for the rest of their lives. Our ability to achieve the goal of living in our own homes will be largely dependent on our knowledge of the aging network, our support system, and in some cases, our financial status. The continuum of care can be confusing, and the opportunities to access care along that continuum will be dictated by where we live and the kinds of services available to us.
Thanks, Stacey. So I know a little bit later on this afternoon, you're going to help us, sort of break down that continuum of long-term care and help us understand what those options are. So there's a lot to consider, but I think what you're saying is the first step is to have an honest and ongoing conversation with your loved ones, right? Because what's right for your mom or your dad or whoever you're caring for today at 65 or 75 could be different in just a short period of 5 years, or hopefully 10 or 20 years, right? So just to keep on top of it. Okay. So speaking of loved ones, my mom is going to be 75 this year and has unfortunately experienced some significant health issues. And as a result, her desire for food, her desire to eat, her ability to taste foods and enjoy food has really dropped off, and it's just become a chore for her. She just is, just not into it. And so one of the biggest downsides to her non-appetite is that she needs to take her food, or she needs to take her medications with food. And, the couple of times that she tried to do it without food in her body, it just really kind of set her back. So Lynn, let's talk a little bit about some of the changes that we can expect to see as we age, both for ourselves, for the ones that we're caring for, and what do we need to know about what our bodies need today at our current age versus what they might need in 10 years or 20 years?
Yeah, that's a great question, Sarah. And really, your mom is not so unique. There are so many people and so many reasons why people can't eat, whether it be as simple as a toothache or they have GI distress. But it's important to understand and think of food as medicine. Food can have a profound effect on influencing disease. In fact, 50% of the top 10 chronic diseases can be prevented or treated with nutrition. Thus, when I talked about those dietary guidelines of Americans, they are developed so you can attain all your nutrient needs, which in turn will help improve health outcomes and decrease your risk of developing those chronic diseases. So what exactly happens as we age? Why do our dietary patterns change? Well, there's four basic things that happen. One, we tend to eat less, and this may be due to living alone, as Stacey just touched upon. It may be that we have no social aspect to eating. A lot of times we eat because it's a large group, and when we're getting elderly, we tend to don't have that social aspect to eating anymore. Sometimes there are those dental issues, as I had mentioned, that challenge us to have food intake, or plain elderly people can forget to eat. So the challenge is to make sure that we get quality foods to fill all our nutrient requirements in the limited amount of calories that we take in. So in other words, we need to concentrate on nutrient-dense foods. Importantly, it's critical that we add some protein to our diet as we age. This will prevent sarcopenia, which is essentially muscle wasting that is very prevalent as we age. The second thing that happens is naturally our nutrient absorption decreases, which can be exacerbated by digestive issues as well as those medications that we have to take for other diseases. The third thing that happens is food insecurities or access to food. And, we just may not be able to get to the grocery store for whatever reason. And it's really important to note that food insecurities directly correlate with longevity and chronic disease. The last thing that happens is your immune system decreases. We know with the pandemic that the older population got their vaccines first because they were most vulnerable to the disease. And that's because their immune system is weaker. Vitamin C, D, and zinc are all nutrients that can help to boost your immune system as you age. And with these recommendations that I had just mentioned, it's really important that you always educate yourself and never self-medicate or self-prescribe, especially for supplements. What happens is vitamins and minerals may seem harmless, but anything in too large of doses can be toxic and cause problems. Examples include B vitamins and even water. So too much of a good thing can absolutely be toxic.
That's a really important note, Lynn,
Mhm.
because the internet is a vast place of information and misinformation, right? And so we
Absolutely.
can get ourselves worked into a cycle or a place where we're doing so many things and not really understanding the full impact, right? So always, right, do this under the guise, under the care of a physician, right? Or someone
Absolutely.
that you trust had or a registered dietitian or someone, in the field, right? Okay, so speaking of education, Anne, let's go back to the story about your friend. Let's see here, probate. Oops, sorry about that. What is it? What are the differences between probate, non-probate? Why does it matter? Why should we care? Oh, Anne, you're on mute.
I'm so sorry. Can you hear me? Can you hear me now?
Yes.
Okay, sorry about that. What is the probate process? So probate is the court supervised process of locating and determining the value of a deceased person's assets, paying their final bills and taxes, and distributing the remainder of the estate to the rightful beneficiaries. The probate court will also authenticate a will if there is one. Not every asset needs to go through the probate process though, and that's what I was talking about before with my friend. So what are non-probate assets? An example is a bank account that's held jointly with rights of survivorship or has a payable on death designation. Investment accounts that derive from contract law. As long as there's a named beneficiary, that person will inherit. It goes through contract law. It doesn't necessarily matter what a will says in that situation. If there is a named beneficiary, that's who will inherit. So things like IRA accounts or 401k accounts. Life insurance, that is a non-probate asset that will go to a named beneficiary. And I give the example of, recently my husband and I were reviewing our investment accounts and our life insurance, and he had our 3 children as the primary beneficiaries. And he said, well, I just thought you were automatic as my spouse and that the beneficiaries should be the kids. And I said, oh no. And he was able to change this right online. It should be me as the primary beneficiary and then the children as secondary beneficiaries should something happen to both of us. So this was, he's not an attorney, but he's a business person, and he just thought this was sort of the way it went. So sometimes you just have to educate yourself and know what you need to know on that. And then any real property that's jointly owned. So for example, the marital home with both names on the deed, that will be co-owned property that would not go through probate. The other thing that you could do with a marital, or if you singularly own a home, is you can, in some states, file something called a transfer on death deed. So in that situation, the home primarily stays in your name, but should something happen to you, it automatically transfers to the person that's designated on this transfer on death deed. Also, any assets that are properly held in trust are non-probate assets. And this is when you'd want to get an attorney involved to make sure that, you know, you are properly titling those assets and taking care of them. What are probate assets then? Any other property that is not co-owned and that's held in the decedent's name. So for example, a car. A car would be, you know, if it's held in your name, that's a probate asset. Fortunately, here in Ohio, we have something called a spousal affidavit that you can file that will move that car into the spouse's name without it going through the probate process. But mostly probate assets would transfer at the direction of a proper will. And if there's not a will, the assets are distributed by sort of a schedule determined by law. And these, you know, they're almost like a family tree. First, it goes to spouse and children, then it goes up to parents if there is no spouse and children, and then off to siblings. So it's almost like branches of a tree. So back to my friend's example, you know, they co-owned their home and their bank accounts. She was the named beneficiary of all his pension and investment accounts. His major singular asset was his car, and the provision in Ohio for a surviving spouse to transfer that car outside of the probate system allowed her to do that. Looking at everything after 40 years of marriage, the only thing he really owned on his home, owned on his own, were his personal effects, clothing, etc. And those did not need to go through, you know, the probate process because they weren't of significant value. He didn't own jewelry or artwork or anything of significant value. But it's important to note that even if an estate doesn't need to go through the probate process, you will still likely need to pay taxes on anything that you receive from a decedent, and you're going to have to consult your accountant. You know, there's also in some situations where you have to go through, you know, filings for probate, but you're not probating the entire estate. So you may have to file like a notice probate, but that's all. So these are complicated questions sometimes, and you know, you may want to talk to an attorney. But if you have these beneficiary designations and you can sort of title most of your major assets in a certain way, you know, having beneficiaries, having co-ownership, you can avoid a lot of the issues that come along with having to probate in a whole estate.
Thanks, Ann. So I heard you mention beneficiaries again, but this time with the distinction of primary and secondary, right? And to keep those in mind, because going back to your example, your children would have received, you know, all of your husband's, you know, all of his investments, right? And so,
yeah. So for example, they would have gotten his life insurance, and then I think I would have had to hold them in trust, or, you know, it would have been a real mess for me to be able to use that money for the kids' behalf to do something like pay our mortgage.
Right.
And it was simply on his part an error, you know, that he just thought, oh, well, I thought it should be the kids, because most people do think, why are we buying life insurance? To make sure our kids are provided for. But it really should go through me as the decision maker.
Right. Okay, so beneficiaries, primary and secondary, can really help simplify things, right, in this particular situation, okay? And then keeping them current is another thing, maybe periodically reviewing who you is primary and secondary. Okay, it's really good stuff here. Okay, so let's jump back to long-term care, something that hopefully gets to happen for a very long time before we get into wills, assets, probate, non-probate. So Stacey, can you talk to us a little bit about what the resources are and what's available for long-term care in terms of options? Can these resources be used for both the person who is looking for care for him or herself and for the folks that are in their care for that time period?
The continuum I'm going to talk about today is the continuum of care for people in need of additional supports. Although there are some agencies that will offer these supports across the continuum that meet both the needs of the caregiver and the older adult, the categories I'll talk about today are geared toward the needs of the older adult. So whether you're planning ahead for your own needs or exploring services for someone in immediate need of care, this continuum is applicable. The continuum of long-term care services and supports that you see here is a description of how I see these services in my mind. This isn't a hard and fast description, and if you meet with 3 of my colleagues, they are likely to have a different name for them and or place them somewhere else along the continuum. The important thing is to understand your options across the continuum. So in addition to knowing what your options are, it's also important to understand who delivers these services and how the services or people are paid. Today, we'll just have a few minutes to talk about the topic, but upcoming sessions will offer additional information.
So Stacey, there's a lot of information here, and I think, with all these different levels, having different multiple services within each level, what kinds of services are available to people that fall into the first and second areas of the continuum?
The least restrictive option is to live in your own home, in your own community, with occasional support through an informal network or limited formal services. The 2 categories on the continuum that I'm going to talk about are both categories that assume the older person is living at home in the least restrictive environment. Some older adults can live more than a century in their own homes. If your cards fall the right way and you're healthy, financially secure, and have good support, this option is definitely in reach. The first category at the far left of the continuum assumes that you need minimal help. Examples of the things someone aging in place might need are transportation, household tasks like changing light bulbs, heavy cleaning, taking trash to the curb, assistance with shopping or bill paying. This kind of support can be delivered in various ways. Through senior housing, many senior housing buildings or communities offer a list of trusted providers that can be hired privately. Other buildings or communities may offer a menu of services that can be purchased as a part of a package. Assistance through family, friends, and faith communities, or even neighbors, are an example of informal supports. The village model is a model that has cropped up over the last 10 to 15 years and is a neighborhood level paid membership model, allowing access to services in the home, such as those that I mentioned a moment ago. These villages are available in communities across the country, and there are several located in Cleveland. You can make adaptive changes to your home, and these are things that you can make to your own home that may promote independent living as you age. Some of these changes can be minor and others can be quite expensive. They include changes like widening doorways, making shower facilities accessible, adding grab bars or ramps, and for some, even putting in stair lifts or elevators. And then finally, in this category on the far left is emergency alert or fall detection systems. They can be very simple to very sophisticated. You can purchase a wearable device that will allow you to do anything from pressing a button to call for help when in your own home, to a sophisticated system that will detect falls, changes in health metrics, and offer medication reminders regardless of your location. The second category on the continuum is to still remain at home, but rely more on formal supports or services along the aging network to remain independent. Some services require significant homework on your part. The Older Americans Act is available to people 60 years of age and older, and these services are usually at no cost, but are prioritized more to more vulnerable persons. So if you live in a mixed income or diverse area, waiting lists may exist for some services. They're offered through many agencies and municipal aging providers and include things like transportation, supportive services, and congregate meals. There are private and local services. Some cities offer special services for older adults that aren't funded through formal aging funds, things like window cleaning, maybe transportation or snow plowing. You may also find private providers through a community newspaper or your local office on aging who you can pay to provide services or support, but aren't affiliated with formal service providers. There are both risks and benefits of using this type of care. There's home health care. Using a medical or non-medical home healthcare agency in your home is an option that many people take advantage of. A home health aide typically costs between $15 to $20 an hour and an RN around $35. Services can be limited to a few hours a couple of times a week to all the way up to live-in care. Fees range significantly depending on where you live and the agency that's providing those services. And there are many questions that you should ask these service providers before hiring them. And then finally, in this second category is the services available from geriatric case managers or navigators. And these are privately hired people, often nurses or social workers, who should have an excellent working knowledge of both the aging process and the aging network. And they should have connections within that network. Their work involves getting older adults connected to needed services, helping them manage health appointments, and assisting older people planning for age-related changes. These professionals often work closely with clients for years, typically when family support is limited or family lives far away.
Thanks, Stacey. That's I had no idea that so many options existed. In my culture, we live in intergenerational homes. So when my parents become unable to care for themselves, our expectation is that we will live together in some form or fashion, whether it's full-time or part-time or assisted living in that nature. But it looks like there are so many options that can do some of what you need, a lot of what you need, all of what you need. So it's good to know that so many different resources exist to help you in whatever situation you're in. Right now, I'd like to just let our guests know that we're open for questions. So if you have any questions, please go ahead and send them through the Q&A. While we get those flowing through the queue, Lynn, there's a question for you. So the internet has really helped expose a lot of the good and the bad, that's in the world and, in our environment, and can be useful or harmful, right? And so based on your experience and your expertise in this field, what are the resources or apps that can help us not only obtain a baseline of, where we stand today, from a nutrition point of view, but really give us insight and data and information to help us refine our approach and continue growing as our bodies change through the aging process?
Right, yeah. So apps are a great way to give you a snapshot of what you should be eating or give you a check of how well you're achieving your goals or how well you're eating. And many apps allow you to set the goals based on those dietary guidelines of Americans or the dietary reference intakes that I talked about earlier. Those guidelines that are in place so you can decrease your risk of developing disease. So many of these apps are free. They have premium upgrades, but the free basic versions really do the job for you. I use the basic free Chronometer app for my nutrition classes, and we assess our diets, the strengths and weaknesses of our diets. So definitely the free apps are a good place to start. The apps definitely don't replace a registered dietitian or a clinician for sound nutrition advice. However, they really get you started to give you an idea of where you're at and how well you're doing. If you do these apps, I would suggest doing them for 2 weekdays and 1 weekend day, which is standard 3 days. And the reason for that is usually eat differently on the weekdays versus the weekend. But, when you do this, don't feel bad if your diet needs to be improved. Wherever you are now is where you are now. Take your baby steps, maybe by choosing one nutrient to focus on. Honestly, just focusing on that one nutrient will have a domino effect on your whole diet because you'll start to be more mindful of what you're eating.
Okay, that's great, Lynn. So knowledge is power, right? And let's be kind to ourselves, right? Where we are today is maybe not where we want to be, but without knowing where we stand today and what our baseline is, how can we get there, right? And so let's use technology or explore technology in ways that can help us not only document, where we are today, but sort of track our progress to where we want to go. So that's really helpful. And after this session, we'll send you all a list of the apps that not only definitely the one that Lynn mentioned, but a few others that she thinks could really help you in your nutrition journey. Okay, Anne, in our last session, you gave us a list of things that you can do today with no special tools, no special knowledge, no special anything, just the will to get it done. From today's session, based on what you spoke about, what's an absolute must do today? If there was nothing else that you could take away from this, what could someone do today?
Okay, so what I would say is, first of all, if you have minor children, you absolutely need a will that determines the guardianship of your children. Do not put this off. It's one thing to have your assets or your money tied up in the probate court, but to have any sort of family squabbles over your children is just not acceptable. It's not something you would want to put them through after the trauma of losing their parents or a parent. So definitely get this done. Most people feel better having a will as a catch-all, even if, their assets are going to transfer, through the contract system rather than probate. So this is something that, you should start talking to friends about. If you don't have a will, who did you use to do a will, or, your simple estate planning? Because it's really not that expensive, and it's something that you'll feel better, you'll have peace of mind doing. So talk to friends about, somebody who who always has their stuff together. Who did your will? How do I do this? And then the last thing, and this is something we can send out, because these are free documents. The Ohio Hospital Association, Ohio Department of Aging, Ohio Bar Association put together durable powers of attorney for healthcare and living wills. These are form documents where you can state what your wishes are should you become seriously ill. They're sort of check the box. All you need is to sign them and have them witnessed. They can be notarized, but it's not required that they're notarized. And so this is something that you would want for both you and for, whoever you would be making decisions for, to make sure that these are on file, because it just gives some guiding principles to healthcare providers and avoids you having to make those really tough decisions about artificial nutrition and hydration. Should somebody, be deemed, a sort of like brain dead or et cetera. So you want to make sure that you have these on file or on record with the person that would be making these decisions. And again, those don't cost any money. They're available for free. And they've been looked over by the Ohio hospitals and also by attorneys and by the Department of Aging to make sure that they meet everything that you need for those. So those are some things you could do right now. Depending on your personal wealth and your assets, your family situation, you might consider, talking to an estate attorney about a trust, but those are complex, and you're going to definitely want a good estate planning attorney to weigh in.
Yeah. Okay. So, and Anne, you mentioned resources within the state of Ohio, but every state has those lists and those durable, powers of attorney and checklists and things so really it's a quick Google search, right? If you're not.
It really is. And you can look on, I think the AARP website might even have links to every state for these kind of documents. But certainly you could look at your state Department of Aging, and they will have information on these, because really these are things that they've made available for free because they would prefer that the public have these, because when decisions have to be made at the end of life, it can be really difficult for families to make these decisions. And if you've made these decisions in advance, it just gives everybody peace of mind. I'm in my 40s and I have this document ready to go, because what we've learned over the last year is we have no idea what the future can hold. And, when health issues come up, you really need to be prepared.
Right. So you can focus on healing, right? Or taking care of the person who needs care. Okay. Excellent advice. Okay. And so Stacey, I realized I didn't advance the slide, but luckily we're on this slide because I think this question is for you. So as we either for ourselves or for others, explore what the options are, what the resources are, what are the things that someone needs to know as they go through this journey? What are the absolutely necessary essential items?
If you're looking for care for yourself or someone else, you're probably going to be asked a lot of questions. And Anne spoke earlier about gathering together important documents. One of the most crucial pieces of information that will be helpful to you in looking for care for yourself or someone else is to have the name and identification numbers for all healthcare and long-term care insurance policies. Insurance itself is difficult to understand, and it does not cover many long-term services and supports, but it does cover some, and that list is growing as laws change. Having an understanding of insurance policies and a general sense of the financial status of the person needing care will be important. The second area you're likely to be asked about is what are the specific needs of the older person. The extent of care needed will drive decisions about the type of care along the continuum that is most appropriate, especially when combined with the knowledge of their financial situation. Having information about the person's capabilities in ADLs, or activities of daily living, and IADLs, or instrumental activities of daily living, will be really helpful to this process. Lots of people don't live near their parents or loved ones and interact with them only on the phone or through occasional visits. In these cases, it might be difficult to guess their performance. So as a child, you might be really surprised to learn your parent is eating frozen meals or letting bills lapse, because our conversations follow this general pattern and that information isn't always discussed. So if this is the kind of interaction you're having, it would be really important that you have a comfortable relationship and you can ask these questions or observe your parent or loved one doing these things.
Okay, that's great. So what I've heard today is, from Lynn, start small, no judgment, set a baseline, and beneficiaries. Those can really help, keep things simple, right? In times of, of death. And then, Stacey, have that ongoing conversation. Just keep it going, right? Keep it open, keep the doors open, keep the dialogue going. Okay. In our last few minutes here, let's just go around the room and can you just give us just one thing you've learned from this past year that you'd like to pass along to our audience?
Yeah, I'll start. I think this is the thing that I saw recently, that the American Psychological Society published a study that said 61% of Americans had undesirable weight fluctuations during this pandemic. So I think that, when we think about that and we think about the connection of obesity, how it contributes to many diseases, including heart disease, diabetes, and even neurological diseases like Alzheimer's disease, it really underscores the fact that there's definitely a connection between our dietary habits and our ability to live longer, and how we should be mindful of what we're eating and educate ourselves.
All right. Thanks, Lynn.
I'll jump in next. This is Anne. What I'd say is, what I've learned is that it's never too early to be prepared. And I think we as a society have learned that as we have seen news reports of somebody in the prime of their life being taken by this, horrible pandemic, that it's just never too soon to be ready. And the conversations that I've had with my family, I don't think that I would have had a year ago. They would have said, oh, we don't need to worry about that yet, or we're too young to deal with that. All of a sudden, people are more willing to have these conversations, have documentation ready, because we just know we can't take anything for granted. So it's never too early to start planning.
That's great.
And I will say that I have certainly read the research, and I know that it supports the importance of social engagement to improving health and well-being as we age. But that was made so much more clear to me over the last year, watching my own parents become increasingly socially isolated. My dad in particular has aged a great deal during the last year. So I think my takeaway is how important it is over the course of our lives to build connections with other and develop hobbies outside of work, so that we have those connections when we retire.
Really great advice. Okay. Well, this brings us to the conclusion of our session today. Thank you all for attending. Want to let you know that the third of our series is coming up in April. We'll send you a link to register for this. Thank you, Anne. Thank you, Stacey. Thank you, Lynn, for your information and your time today. Yeah.
I have one question. It looks like there's a question in the chat box about where to get information regarding a diet as we age.
Yes. Okay. So Lynn, would you like to take that question?
So one of the best places I would say right now, I mean, this is sort of an open-ended question that can't be quickly, but the Tufts Health and Nutrition is a really good resource for aging, for nutrition as we age. And this is in coming up sessions.
Okay, that's great. We'll be sure to include a link to that in the follow-up materials. All right. Well, thank you so much, everyone. Hope you have a wonderful day and hope to see you in April. Take care.
Thank you.